Hey, have you ever stopped to wonder what your body is really trying to tell you? Well, today we're going to pull back the curtain on two key tools that help us listen in: ECGs and basic health screenings. We'll get into what they are, why they're so important, and what you can actually learn from them. You know those days, right, where you're just feeling off? Maybe you're tired, a little dizzy, something's just not right. It's so easy to just ignore that stuff and push through. But what if those feelings are actually your body trying to send you a really important signal? So, the big question is, how do we get better at listening to those signals? Well, it really starts with seeing them for what they are: early warnings. Think of them like little clues that can help you get ahead of things and take charge of your health before a tiny issue snowballs into a much bigger one. Okay, so when should you really be paying attention? I mean, some things are obvious, right? Chest pain, shortness of breath, a fluttering in your chest, those are definite red flags. But sometimes the reasons for getting a screening are way more subtle. It could be something like a family history of heart disease or stroke. Or, hey, even something positive, like if you're about to start a new, intense fitness program. All of these are perfect moments to get a baseline and just see where you're at. It's just a smart move. All right, so let's say you've decided, yep, it's time to get checked. What actually happens next? Let's dive into the tools doctors use to get a really clear snapshot of what's going on with your health. And trust me, they're simpler and more powerful than you might think. So we're mainly talking about two things here: the ECG and basic health screenings. You can think of an ECG as a specialist, like an electrician for your heart. It listens to the electrical signals to spot any weird rhythms or potential issues. Then you've got the general screenings. These are more like your all-around health detective, checking things like blood pressure, blood sugar, and cholesterol levels to find any early clues that something might be up anywhere in your body. And here's the best part, really. Despite these kind of technical-sounding names, both of these are super straightforward. We're talking quick, totally painless, and they are absolutely fundamental when it comes to being proactive about your health. But that leads to a really important question, one I hear all the time. Can an ECG really detect all heart problems? It's so tempting to think of one test as a magic bullet that tells you everything. So let's get real about what an ECG can and can't do. Okay, so here's the deal. An ECG is fantastic. I mean, absolutely top-notch for spotting those electrical and rhythm issues. But your heart is complex, right? So for the full picture, a doctor might need to combine it with other tests. Maybe a stress test to see how your heart handles exercise, or an echocardiogram, which is basically an ultrasound for your heart to see its structure. It's all about putting different puzzle pieces together to get the complete picture. All right, let's talk about the experience itself. What does this whole screening process actually feel like when you're there? Let's walk through it, step by step, so there are no surprises. It's usually a really simple four-step process. First up, you've got the ECG test itself. Then, they'll do some comprehensive blood work. But here's the most important part, in my opinion: the evaluation. This is where a doctor sits down with you and doesn't just throw a bunch of numbers at you. They actually explain what your results mean for you. And from there, you get a personalized plan. The whole thing is designed to give you clarity, not leave you more confused. Okay, let's tackle the elephant in the room. Is the ECG test painful? This is probably the #1 question people have, and I totally get it. I mean, a test that measures your heart's electricity, it sounds pretty intense, doesn't it? But the reality couldn't be simpler. The answer is a big, resounding no. It's completely non-invasive, nothing pokes you, nothing goes inside your body. You just lie back, they stick a few sensors on your skin, and those sensors just listen. It's over in just a few minutes, and there's absolutely no discomfort. Seriously, it's one of the easiest medical tests you'll ever have. And that brings us to the real reason we do all this: the payoff. It's not really about the test itself. It's about what you get after the test. It's about that feeling of clarity and the confidence that comes from truly understanding what's going on inside your own body. You've probably heard this before, but it is one of the most powerful truths in all of medicine. Early detection can make all the difference. And it's so true. Catching something early can literally transform a potential crisis into something you can manage. That's the whole point of screening. That's the goal. So if you're going to get a screening, what makes for a good experience? Well, a few key things translate directly into peace of mind for you. Having licensed physicians means you know you're getting expert care you can trust. Modern equipment, that just means you're getting fast and accurate results. And a same-day discussion, this one is huge. It means no more waiting around for days feeling anxious about what the results might be. You get a complete picture of your health right then and there. And I just want to double down on that point because getting your results and having someone explain them to you in the same visit is a total game changer. It takes the whole experience from something that could be filled with anxiety and waiting and turns it into a moment of immediate clarity. It's all about getting you answers, not making you wait. Okay, so we've talked about the tools, we've walked through the process, but the most important part of this whole conversation is what you do next, how you use this information to really take control. Because at the end of the day, that's what this is all about. These screenings give you a baseline. It's your personal health starting point. And that knowledge, well, that knowledge is power. It is the absolute first, most critical step you can take toward proactively looking after your long-term health. So, I'm going to leave you with a simple question to think about. It doesn't have to be some massive, life-altering change. It could be something small. Maybe it's just making the call to schedule that checkup you've been putting off. What is one simple choice you can make for your health this week?